I would certainly say considering your evidence base is probably pretty mission critical. I think it's very easy for companies to assume they have a great product, but unless there is a compelling evidence base, no matter where it has come from, whether it's the UK or in other markets, that really supports that scale, credibility, and that engagement really from other healthcare professionals or system leaders that might want to consider using your product or technology.
Welcome to the H-Files, the new series of the Hands-On Business podcast, where we dive deep into the world of healthcare leadership and the unique challenges facing small to medium-sized healthcare businesses. I'm Hakeem Adebiyi, and after years of helping businesses grow in various industries, I'm excited to focus on the area that I know the best, healthcare, one of the most dynamic and impactful sectors in the world today. In this series, we're going to explore what it takes to lead and grow in healthcare, from navigating the complexities of regulation and innovation to overcoming the everyday hurdles of building a sustainable business in this fast-paced environment. Each episode will feature real-world insights, expert interviews, and actionable strategies that can help you push your healthcare business forward. So whether you're a leader in the space or an entrepreneur ready to break into it, the H-Files is here to give you the edge. If there's one thing that we've learned from the past few years, it's that borders may well be physical, but innovation knows no limit. Now, just recently, the UK secured a place in the CPTPP trade bloc. Yeah, very easy for me to say. That's the Comprehensive and Progressive Agreement for Trans-Pacific Partnership. So, for the layman, that's basically unlocking access to Asia-Pacific markets like Japan, Australia, and Singapore. And meanwhile, negotiations are also heating up with the Gulf states in India. And these are two regions which are booming in demand for health tech solutions. So for UK SMEs, this is a golden opportunity. And, it's an opportunity, but having the opportunity and then knowing how to break into those markets is the real challenge. And that's where today's guest, Suzie Ali-Hassan, comes in. Suzie is the International Business Director at the Association of British Health Tech Industries, ABHI. And ABHI has just launched an international accelerator, or is just about to launch an international accelerator, designed to help UK health tech SMEs expand into global markets. And it's going to give them connection strategies, it's going to give them marketing intelligence, and all those things that they need to succeed. So whether you're a small business eyeing Asia, the Middle East, or the US, or any other market actually, then this episode is hopefully going to give you some insights into how to navigate international expansion and avoid some of those common pitfalls. So we're going to dive in. So welcome, Suzie. Glad you could join me on the show today.
Thank you very much, Hakeem. It's lovely to see you and happy to be here.
Excellent. So to kick off, I always give a softball question to get everyone into it. So what's one piece of advice you'd give at the outset for anyone trying to make a big impact in healthcare in field if they're trying to expand?
I would certainly say considering your evidence base is probably pretty mission critical. I think it's very easy for companies to assume they have a great product, but unless there is a compelling evidence base, no matter where it has come from, whether it's the UK or in other markets, that really supports that scale, that credibility, and that engagement really from other healthcare professionals or system leaders that might want to consider using your product or technology.
Yeah, I think that's a really important point, actually, just to kick off with, and several people have said that, several guests, in terms of you might think it's a great product because generally it's come out of your mind and you think it's brilliant, but you need to test the idea before you start spending lots and lots of money on developing it. I think that's a really good place where to start. So based on that, let's just take a step back and talk about yourself. So just tell us a bit about your background and what led you to being, an international business director for ABHI and focusing on international business development in healthcare and health tech.
Yeah, absolutely. I mean, it's been quite kind of a journey, I guess, for me, in that I very much started as a research scientist, so a lab-based scientist. I did molecular biology at university and postgrad and spent a number of years in the lab. I moved into the wonderful organisation that is the NIHR in the UK, so the National Institute for Health Research, and supported companies engage with that clinical research infrastructure. I sort of moved through that brokering and development of research collaborations through to kind of organisations that supported economic development of sort of clusters and regions in the UK. And then latterly, a role within the Health Innovation Network, so the innovation infrastructure in the UK to support adoption and uptake. So I guess I've kind of moved very much from bench through to sort of bedside. So followed and supported the journey of innovation and technology from kind of the creation of it through to its development and then latterly into the health system and adoption. Throughout those roles, I've worked internationally, and I think that's always had to play a role in how companies and how, you know, industry partners I've worked with had to consider commercialization. It was always with a view that international partnerships were very, very valuable and of equal value to engaging in the UK. So I worked closely with the ABHI over the course of those roles for a number of years, and their international team actually in particular. And I was delighted when an opportunity arose where I could really then focus on that internationalization and supporting UK businesses grow and expand overseas. And I think critically, it's about allowing the UK business to grow and form partnerships, but not necessarily leave the UK as a headquartered entity. So very much supporting that kind of economic growth and development agenda for sure.
No, I appreciate that. And it's an interesting one because I think it's a really valuable service because it was only recently I was at a meeting and I found out that it's only 10% of UK companies export. So I think it's really quite important. You just outlined there, if it's a big part of the growth strategy, then we really need to be helping those SMEs in the UK to start understanding how to export and actually doing it successfully. So moving on to, and that's a bit about you, which is really, really valuable to the context of your experience. In terms of the ABHI, because some people might not have heard of it, what are they and what's their role and what do you see their role is in supporting UK health tech businesses?
Sure. So, the UK, the ABHI is the UK's leading trade association for the health technology industry. So we represent the health tech industry in the UK as a collective, and we very much advocate for that industry at various levels within the UK ecosystem. So critically at a government affairs level, and we support guide and advise policymakers on how and what will affect UK industry if it's not developed efficiently and effectively. Of course, health system leaders and other stakeholders critical to the sort of the success and growth of the ecosystem, but also, of course, directly with the NHS as the largest healthcare provider here in the UK and the private industry on working with that industry. So how do we play a role really interfacing between those two key stakeholders and making actually it successful? The sort of domestic agenda critically is around adoption of innovation and access for UK technology into the health system, which is, as many you will well know, Hakeem, and many of the listeners will know, is always a challenge, particularly within the NHS. So how do we make sure we're at the right tables, having the right conversations? And that's anything from the regulatory landscape and environment through to trade and export and how we support that industry flourish overseas. So the domestic agenda is very present and very active, but I guess the international team, which I sit in, is sort of adjacent to that sort of domestic work, but still plays a very critical role in supporting that UK industry flourish. I think we realise, as I say, the NHS can be challenging. So how do we support growth in other markets in parallel to engaging with the NHS and that system? But the ABHI is a really significant and important stakeholder both within the UK and internationally, where we link in with our equivalent organisations and sister organisations in other markets to really talk globally about challenges that are faced by the health tech industry.
And the challenges are many, and I'm sure we'll
yes, they are indeed.
Some of those. So in terms of obviously one of the things that we agree, the reason why we agreed to do this, because you're obviously launching the International Middle East Accelerator. So what is that, and what inspired its creation? Because you've obviously been involved as an organisation in international and domestic, you've just outlined. So what inspired this accelerator program?
Yeah, so well, we've so the Middle East Accelerator program is newly launched as of the end of last year, but the model for it has very much been taken by the success of our US Accelerator program, which has been running for just going into its 8th year now, and that was created recognizing the USA as the world's largest healthcare market, the demand from industry, and a need to support companies navigate the kind of the complexities of that system. So it was created really uh, initially out of this, as people might know, there is a federal system in the US, but everything is very state by state governed. And so we support and engage sort of statewide, often focused on the healthcare systems based within those states. And we've built bridges and engagements and networks of health system stakeholders that kind of, I feel, are quite unparalleled, really. It was set up to de-risk market entry for UK businesses ultimately. And there's been incredible successes off the back of that. We've generated about £150 million worth of contracts for UK businesses over those 8 years. We've supported well over 100 UK businesses on those programs. 70 clinical trials have been brokered and developed across some of the research infrastructure in the US with UK companies, et cetera, et cetera. So based on that success, and again, based on the demand from UK companies, we've set up a similar program to support companies enter the GCC. In particular, to start with Saudi Arabia as the biggest healthcare economy in the Gulf, and also the UAE as again a significant and important stakeholder and country sort of in region. We also have a couple of international exhibitions that take place in those markets as well, which are supported. At a very high level, the accelerators are 12-month programs of support for companies that are recruited annually onto the program. There is a learning and engagement series. They have access to mentors and experts about across all aspects of requirements about that particular market. And I guess I always say the jewel in the crown is dedicated trade missions out to market over the course of the 12 months. So there are up to 4 missions over the course of the year. And with the Middle East program, we do also include access to our trade shows. So it's a very concentrated, dedicated program of engagement with consistent access and meetings with key people in market. Yeah, we're really proud of it.
Excellent. No, and it's good. And obviously, we'll talk about the Middle East one in specific, and you're obviously looking to expand that because obviously you've got the US one, which has been very successful. You've launched the ME one. I'm sure there's others to come. So if you were looking at it as I'm a SME business, and I'm thinking, oh yeah, I'm watching this podcast of the accelerator program. What would say maybe the top 3 things that you think that the people coming on, the businesses coming on to the accelerator would get out of it?
So I think, first of all, the kind of deep dive into, the market itself. So sort of from introduction to the kind of key stakeholders and key players in market, the ecosystem stakeholders, obviously the hospital systems themselves, everything that you might need to know about the reimbursement landscape through to kind of regulatory environments, et cetera, et cetera. So there's certainly that learning and education is key. The second is direct introduction and engagement to potential customers and partners in market through our trade missions. So I think obviously that's pretty business critical to any company coming onto the program. They get to really meet with people that are interested in working with them in some capacity. And I think thirdly is exposure. So there is an awful lot of PR and comms that come out of being part of these programs as working with the ABHI, but also where we support that actively in the program is that we really want to amplify visibility in that market. So those 3 areas I think are probably really of benefit to companies that choose to come on board.
Okay, thanks, Sarah. And I suppose that leads on to the next question. And it may have already been answered in your answer there. So what would you say are the key challenges that UK health tech SMEs face when they are trying to internationalize? And I think, as you said, they're the top 3 certainly. understanding the market, understanding reimbursement is certainly one of them. Is there others that you would say actually these are quite high up on almost?
Yeah, I mean, I think there is something around market saturation, right? And who you're competing with. And I don't just mean in terms of the technology itself and who your competitors might be. I mean, who you're competing with at global scale to get in front of the right people, to introduce your product to, etc. And particularly newer markets, if I'm allowed to call it that, like Saudi Arabia, for example. We're competing with Australia and other big European countries and China and etc. I mean, to have proper time with some of these system leads and decision makers within the hospital systems in Saudi is challenging for an individual company. So that's partly why we've developed this program too, is because we kind of get you in a room with some of these people, and you're associated with brand and the British thing, etc., which can open some doors, linking in with our program. So I think that's probably one of them. It's kind of it's a bit of a needle in the haystack kind of situation often. So any support that they can get is probably quite helpful.
I think that's a really important point, actually, because I don't think people often look at it, as you're saying there, in terms of a countrywide thing. Because you're right, if you go to Saudi, virtually every country in the world is trying to get into Saudi. You go to Japan, you go to America, etc. Every country try to get in front of those same customers. So actually having guidance, having an understanding of who you should be seeing, and actually those introductions you said are key, because otherwise it is very much, if you're doing it on your own, yeah, it's like, as you said, it's a needle in a haystack in a dark place.
Absolutely, when you don't really know who and what you should be talking to and how you should be presenting the opportunity. So yeah, for sure.
Yeah, no, that's really, really helpful. So and then in terms of if you're looking at the key factors, the key things that a UK healthcare company should be looking at, a health tech company, what they be? Obviously, you've talked about the market. You've talked about understanding who to speak to. Is there anything else, or would they be the main considerations?
I'd say the main thing, I mean, I guess my experience and time spent in the Gulf recently, one thing I'd say is that it's much less about pure transactional selling often. And I think particular markets like Saudi, they've gone past the point of looking purely for things to buy. I think it's all about driving partnerships. And I think companies often need to perhaps approach potential customers, within reason. Obviously there's a business, your business to business engagement here, but there is a need to look at ways of collaborating and investing in Saudi, if not financially, I mean with commitment to region and finding ways to support kind of some of their sort of their national strategies, the Vision 2030, all of this kind of stuff. So just to go there with a bit more of an open mind, and forming relationships with potential customers as opposed to making it purely transactional is just more a bit of anecdotal advice, I'd say.
No, I think you're right, and I think it's the same in any sort of business, isn't it? And I think this is possibly a mistake that lots of companies make, is that they think, oh well, I'm going to go to such and such country, and they're going to just love my product, and then therefore I own the product. They have to jump as high as I tell them to. Whereas actually, and I always say it to businesses, whether you are here or you're not, that company or that country has objectives that it's trying to achieve. So if your product and service can help them achieve that, that's a much better way of positioning it, rather than just saying, look, this is a great product and it's going to be revolutionary. Well, is it fitting in, as you said, to their health strategies, to what they're trying to achieve? And actually, that leads me on to a question about how do you choose export markets? Because it's interesting, because I know what I say to companies, and when I'm talking to them about how they choose, but you've chosen, in terms of your accelerator, you've firstly chosen the US, and then you've chosen the Middle East and Saudi as a beginning part of that. So how have you gone around deciding which markets you should do the accelerator in and why? And then follow on from that is then how do you think that organizations, SMEs, should choose the markets that they go into?
Yeah, so a lot of basically our efforts were, you have to kind of consider market size and opportunity, I guess, and there's a cross between the two. And as I say, the US very much being the largest healthcare market in the world, and equally, I think where there is big opportunity for UK US sort of trade, really. So that was certainly targeted out of both necessity to some extent to support UK businesses, but also, again, opportunity. I think with the Middle East, we kind of picked that because there was a huge demand and there is a huge surge of transformation and engagement coming out of the Gulf via Saudi, for example, to internationalise, to engage, to open up, etc. So, and there's a lot of government to government kind of relationships going on there that we as a national stakeholder who work closely with the UK government can and should play a big role in. So I guess that was it. That was it really in terms of our choice. I guess from a company perspective, it's not that much different. You have to look at, what's accessible as a starting point and a starting geography for you in terms of commitment. Are you going to take a 20-hour flight to Singapore to try and engage in that market on a monthly basis, or are you going to look at somewhere where there's a little bit less opportunity cost, but equally as much of a sort of potentially demand for your solution as you might imagine? Of course, there needs to be some market intelligence and engagement that goes into that. I think part of what the international team at the ABHI does is support people consider what that could be. And I certainly think our trade and exhibition portfolio, which there's 12 all across the world, help companies kind of consider what that opportunity is without committing to a full-blown program like an accelerator, if you know what I mean. So there's a testing of an opportunity and an idea before you sort of completely focus and go for it.
And I think so, and I think that also it's the cost of getting into some, because the cost of getting into some markets is much more expensive than the cost of getting into other markets. And I think that businesses often get bamboozled by the market size of certain markets. And as you said, I mean, Singapore isn't a massive market size, but it's a very strong market size because they spend a lot of money on healthcare. But as you said, you have to think about the practicalities of what you're going to be doing, and it's going to cost you a lot of money to be going to Singapore on a regular basis.
Especially as your first market, that's it. I think these things come, but you have to do it in a structured, sensible way, I think. And Singapore might not be the first place you choose.
No, exactly. And it's interesting what you said, because we in some of the early answers you were talking about the partnerships and understanding what that local environment's around. And I talk a lot about the importance of local partnerships. And you mentioned about facilitating those connections. So exactly how does the ABHI do that? Because I think that's a really important and probably one of the most important things when you're going into a market is actually having trusted partners in that region or that country.
Well, absolutely. I mean, and I guess that's what we spend a lot of our time doing in the background is, both getting over there ourselves and spending time with the sort of senior leadership in these hospital systems, particularly in the US. That's years worth of development and engagement and network building before we launch that accelerator program. So we have a very unique set of networks and connections across some of the states in the US that we visit, and we do feel that they are quite sort of, you can't really compare them to anything else that exists. So that's how we have built up our network and how the success of the US program certainly has formed. So the Middle East, we do work with some local partners to support us with some initial engagements and connections locally, because it is slightly less clear than the US in terms of how you begin those networks and begin to link in with hospital systems. But we've got support from the British Embassy in Riyadh, for example, and the UAE. And equally, we have some partners we work with locally to begin to build those bridges for us, which is really exciting. So it's a lot of air miles and a lot of calories burned sort of walking the floor of some of these hospital systems to build the connections on behalf of the businesses that sort of join up to our programs.
Yeah, no, and I think it's so critical, because it's so easy to get in to bed with the wrong partner,
Yeah.
pardon the pun, and then you have serious problems, because if you sign the wrong contract and you can't get out the contract, especially in the Middle East actually, and you can't get out that contract, and it's not delivering for you, that can just lead to a world of pain. So actually getting into the right partnership in the first place is critical, and obviously the work that you're doing will enable people to do that much more successfully. So I think that's really important. I don't think you can overstate that, actually, in all honesty.
Great.
And then in terms of, because obviously you work across the health tech sector, you've worked in lots of different areas. What would you say are the trends that are starting to shape international health tech expansion right now? Is there anything that jumps out to you that in terms of maybe products?
I guess it depends slightly on market. I'd say in the Middle East, they have and sort of Saudi and others, they do have access to, and probably you know, aren't short of very shiny new capital equipment or acute care medical devices and equipment in hospital systems, so that they have built very sort of clean, shiny, new infrastructure. What perhaps they do lack slightly is some of the community-based care, home health care they call it, and opportunities to screen populations out of the hospital system. So those I do feel perhaps are opportunities, particularly in Saudi and the UAE. Equally, anything sort of like I mentioned, population level screening, but sort of diagnostics in that capacity, anything that can be quite kind of interventional in that sense is very, very interesting. And I mean, across the US and the Middle East, we certainly notice, we assume with private healthcare provision that everything is very efficient and organised, and the data systems are being used really well and effectively. And actually, it's not quite like that really on the inside. So anything that supports automation, efficiency, patient flow, sort of legacy data and accessing and using that effectively and organising it is really, really of use. Oh, and not oddly, but interestingly, sort of waste management, right? So some of these things that we don't think are particularly, sexy or whatever you want to call it, that there's a huge need, and particularly ones that are linked to kind of environmental sustainability or have, impact on environment. There's a massive challenge with that across the board, and I think perhaps more of an opportunity in the Middle East actually than the US, which have less of a focus on that.
Well, yeah, certainly after recent elections, they've got even less of a focus on.
Absolutely, I know it might be out the window entirely now.
Yeah, I think that's probably going to be quite problematic if that's the area that you were in, and the US was looking like a large market, and I think, but this goes to that point. Almost in terms of understanding your markets and understanding the trends. Because certainly I know when I was working for a particular company, and it was actually in waste management, actually, then the places like Italy were always a challenge because they had lots of elections. And healthcare there,
political football.
Exactly. So healthcare there was driven by obviously politics. So you could have a massive opportunity today, and then at the time I was working there, right, seemed to be having elections every year. So then you'd go back, say 6 months later, and they say, well, we're not going to do anything because there's an election that's coming up, so we're going to wait to see what happens there. And then that election comes in to freeze the budget. So it is important to understand that landscape as well before you start investing loads of money. That's why I think trends and looking at what opportunities are over the next horizon period is probably quite important, rather than just saying, oh, well, at the moment, then there's a huge opportunity here, without really looking at what the landscape. And you talked about Saudi, and they're very good at having plans for 10, 20, 30 years.
Gosh, yeah.
And if you can jump in on that, as you said, I think that's really important for companies to understand.
Yeah, certainly.
Okay. And then so if a company comes to you, and I'm sure some of them do, or you speak to companies and they're not sure about going international, what would your advice to those companies be?
I guess I'd say, if you're not sure, no, I guess what I would say is that to commit to some of these programs, there is a necessity to have some sort of certainty about entering that market, right? So what I'm trying to describe is that we would need, we wouldn't want to take somebody onto some of those accelerator programs, for example, unless they were sure that this is what they wanted as a business objective. However, we recognise there are companies that are completely new to thinking about international and aren't quite sure where and how to approach it. And we're certainly open to those conversations, and we recognise that there is a lot of education and sort of learning that we do external to any of our programs that are about international markets. So I'd say engage with us regardless, and you will undoubtedly absorb some knowledge. I think you have to do your research as well. You know, we can certainly be a facilitator and provide some advice, but I think there has to be, it can't be something that's done without proper kind of review and kind of, you know, understanding from them internally as an organisation. Sometimes I feel we can't make a business decision for them. They have to kind of consider it themselves.
Yeah, no, I think you're right. I mean, I think the only thing I'd add to that is that, you know, I was always taught in any business methodology that you should not put all your eggs in one basket. And I think
true.
If you are focused on one market, it's a lot harder to grow than if you're focused on 15. And if something goes wrong in that market, then you're insulated against the challenges. Like if you look at the moment in the UK, there's lots of challenges in lots of areas, including healthcare. And if you're only in that one market, it's a lot harder to insulate your business against stagnation than it is if you've got 15 different markets which have different economic climates, different positives and negatives. It allows you to balance those up. When one isn't performed that well, you can focus on the others, and that was always my drive and continues to be when going international. It just allows you to grow your business probably quicker because you're going across different markets, and one can go up and explode while the other one's not doing that great.
No, very true. That's very, very sound advice. And again, as I said, that's partly why we exist, is because the UK is hardcore. It's hard work. How can we sort of de-risk your growth by supporting you engage in other markets? But that's a really good point.
And then how do you or not integrate with like the Department of Business and Trade? Because, you know, I'm an export champion, and there seems to be quite an overlap in terms of what they try to do and what you're doing.
Yeah. So we always link in with DBT where we can. Of course, they've got posts out in market as well that we connect and link into. Where they have trade missions, we always try and make sure we're kind of aligned and we sort of don't clash to some extent or doing it at the same time. I mean, what we certainly feel is that we are a sort of a bit more of the subject matter expert, I guess we could say. And as I say, rather than sort of standalone missions, what we provide is a kind of a year-long program where there's sort of sustained engagement over the course of time, which we think is quite effective. But for sure, we work closely, and we will continue to work closely with DBT where we can. We work, Embassy out there and others. It's really important to our agenda for sure.
Yeah, I think the focus on an ongoing program is really useful because but one of the reasons I do what I do is, and I've told this story, I don't know if I've told it on the podcast before, but I remember when I started back in export in 2014, and I remember, and I hadn't really done any exporting before, and I was brought in as a consultant to help with a European division of a medtech company. And I remember sitting in the office, well, a cold office actually, but sitting in the office and looking around and thinking, right, so where do I start? And I actually saw a book on the shelf which was called I don't know, Starting to Exporting or whatever, but it's like about a 1,000-page book, and it's more like a textbook. It's like, and I looked at it and I thought, and I genuinely thought, if only there was something like an accelerator which could just take me through the basic steps. And I vowed at that point, I said, I thought to myself, if I do make it in this game, then at some point I'm going to create a course or write a book about it, because there must be lots of other people sitting where I was then thinking, well, what's my first step? So I think having that step-by-step process is really invaluable.
Yeah, yeah, I agree. Everybody, we all love a step-by-step guide. We all have a process. I certainly do, and internally and sort of, about something big and significant like choosing to sort of go into another market. I think wherever there is guidance, I think it's of value, and I think that's certainly what we want to do. We want to structure it. We want to make it easier. We want also for them to realise that they're not alone. So that's probably what's quite helpful about being part of the accelerators, is that you're with a kind of a group of companies that are really trying to do the same thing, that are kind of allies and comrades to each other, and you can learn from them too. That sort of peer-to-peer thing, I think, can be helpful, and knowing that you've got a great community behind you, for sure.
Yeah, no, I think that peer-to-peer and that shared experience, firstly, it makes it less daunting. But secondly, you can share those experiences, and if one person on the course makes a mistake or does something great, actually, they can share that, and then that actually invigorates the rest of the people, and actually gives them ideas that they probably wouldn't have had if they were just on their own plowing a singular furrow. So I think that's a really important part of any course and accelerator program. So based on what we've talked about, it sounds great. I think people who are listening to this, and I know there's lots of SMEs who listen to this, just so, number one, what would be the type of company that you need on there? I think one of the things you said was they need to be sure they're actually ready for that journey. But in terms of size of the company, is it SMEs, is it startups, just so that people who are going to approach it know that they are right for the program?
Yeah, so I mean, we're quite open and cross sector in terms of digital devices diagnostics, even sort of some sort of biotech actually more recently. So we're quite agnostic in that regard. It does help where they have some sort of evidence base, and it does help for them to know what they're looking for when they're going internationally. So that's not to say that there isn't, for earlier stage technologies, they might be looking for clinical partners and trials, etc. That's fine, but I guess some understanding of that's helpful. In terms of the stage of the company, so it is a commercial program, as I say, so it's a paid for program. So I guess some resource behind them being able to engage and get involved is helpful. So, but that's equally to say that they can be also scoping that market. It doesn't have to be that they are that they're sort of orientating their value proposition and where they sit into that market, all the way through to companies that maybe have some customers out in region already and are looking to expand and grow their footprint in region. Sometimes we've even had the sort of appointed distributor, for example, being on board and joining the missions themselves out in region, because it's basically building their pipeline for them. So it's anywhere between scoping market through to kind of established customers already in region. So yeah, we're open to a discussion. We wouldn't take anyone on board that we feel wouldn't benefit from it, really. But yeah, always ready for a conversation.
Okay, and for companies that are watching this and thinking, yeah, this sounds perfect for me, this accelerator, I need to get onto it. So what's the next step? How would they sign up? Where do they go? What do they need to do?
So I think sort of contacting myself as a starter for 10 would be great. I mean, you can certainly find me obviously on LinkedIn. I'm not sure how we can maybe. I'm always mindful to overly publicise an email address. But yes, absolutely. There is an application form which we ask companies to fill out, which is really focused on the product solution, where they're at in terms of their journey. We review that application, and if they're accepted onto the programme, we sort of go forward from there. The programme starts on the 1st of April. So there is a time limit where we need all companies signed up, ideally by the end of February. And then there's sort of onboarding and comms and engagement that we do to support promotion of them joining the programme themselves.
Okay, excellent. And what sort of budget, you don't have to tell me because it might be something you want to keep for the private conversation, but what sort of budget would they be having to set aside for that 12-month programme?
So I think I'd probably rather not say that.
That's fine.
That's okay. Yeah.
No, not a problem at all. So I mean, what I will do is I can put your LinkedIn into the description. So anyone who is watching this, listening to this, and is really interested in the program, which you should be because it's an excellent program, then
that would be great.
Message Suzie, and then she can give you all the details about the program. You can get a better understanding and see whether that is right for you as a business.
Definitely.
And then so we've come to the. I can't believe how quickly this time's gone. It's actually we're already into 40 minutes. It's amazing. I say this every time, but it just always catches me by surprise how quickly it goes. So if there's one thing that you could leave our listeners with, or viewers, depending on how you consume the podcast, like one value. I always like to ask about values as well because I think that's important driving businesses. What would the one value you think is critical in leading a healthcare business?
In leading a healthcare business?
Yeah, internationally or growing it.
Oh, okay. So I guess work with people that are doing some of the hard work for you. I mean, I'd like my sort of lasting message really here to be about engaging with the ABHI, whether that's in the UK or to support their thinking about internationalisation. You know, we are a well-established, organisation that has incredible reach and opportunity, both here in the UK to support your business grow, but also internationally as well. So I think do engage with us. That's a key message, I would certainly say.
Yeah, no, I think that makes perfect sense. You're not alone. Don't try and do everything on your own when you've got people who've got all the experience and all the contacts that can actually help you accelerate your business more quickly, which is obviously why it's called the Accelerator. So, but thank you very much, Suzie. It's been illuminating. I'm sure you're going to get some people who didn't know about the Accelerator, who now know about the Accelerator, and I'm looking forward to see the success of the ME Accelerator, and I'm sure it'll be just as successful as the US one. And thank you very, very much for coming on the show today. It's been a pleasure.
Yeah, me too. Thank you.
So a great episode once again with some really great content and advice from Suzie Ali-Hassan from the ABHI. And if you liked what you heard there about the support that they can offer, which is wide and varied and would really help any business trying to either start exporting or to expand their exports in market, then you've got a great chance, especially if it's in the Middle East, to join their Middle East Accelerator program, which doesn't close its doors until the end of February, Suzie said, and it starts on the 1st of April. So if you're interested, I suggest that you drop Suzie a line, and that information will be in the podcast notes. So thanks very much again to Suzie. I'm sure you found that illuminating. And as I said, if you're interested in exporting or increasing your exports, then as we said at the end, don't do it alone. Work with somebody like the ABHI who can help and support you get into those markets successfully and grow your business. And don't forget to pick up the show notes over at thesalesaccelerationformula.com/podcast-show-notes. You'll also find an option to subscribe to our mailing list so that you can get notes for every single episode straight to your inbox. While you're at it, don't forget to tune in to next week's episode of my new 5 in 5 series, where I share 5 actionable takeaways in just 5 minutes from this episode, which will help you supercharge your business growth. Don't forget to subscribe, like, and share this podcast with your friends, colleagues, and anyone else who might find it valuable. Most importantly, keep the feedback coming so we can keep improving and bringing you more of what you love. Thank you very much for tuning in. And remember, keep listening, keep growing, and keep thriving.